Hello, everybody. Welcome back to Healthcare Experience Matters. So, I am super excited for today's episode, and I want to jump into it right now. We're talking with Jenna Bollard-Marcovitz, and she is a board certified music therapist. And just to give a little background on today's episode, Jenna was put in touch with me from a colleague and friend we both have in common, and that's Dr. Timothy C. Morrison, and he's with Stanford Healthcare. And he was telling me in a previous episode about his career path, and it involved time spent as a music therapist. And as our podcast is geared towards fighting burnout and helping those healthcare providers on the front lines deal with so many of the stress involved in their work to provide in that mission of providing a great patient experience, I was really curious as to what we could learn more about music therapy and if there's anything that we can take from it to help those that are listening to our podcast. So I am so excited to introduce everyone to Jenna. There's just the perfect expert for this discussion. And I'm going to stop talking. I want her to introduce herself and tell us a little bit about her background.
Nice. Thank you so much, Casey. Yeah, I'm Jenna. I've been interested in music therapy and the healing power of music since I was a child. Began exploring and studying music therapy when I was just a freshman, sophomore in high school, I think, because I was able to witness how music impacted my grandfather who had Alzheimer's disease. And I was completely stunned by how music was able to bring him back to the present moment and was able to bring back all these memories for him, help him to speak again, help him to sing. Even when otherwise he was comatose, he was able to sing. So it catapulted me into this interest in the neurology of music, how music can be used to help us rehabilitate, and then so much more. So it's really been a journey that started back then and hasn't ever stopped. It keeps evolving. There's still so much more to learn. Every day I'm still learning more about the power of music. I went to Berklee College of Music in Boston to get my degree in music therapy and got certified and started working for a while out in LA and San Diego, in a lot of different settings. And then decided I wanted to pursue my master's in music therapy to get a even deeper understanding of psychotherapy approaches. So I went back to the East Coast where I'm from and studied at NYU and got my master's in music therapy, where I also kind of hunkered down and did a lot of other internships and trainings that I thought would support the greater mission that I had, which was really providing the healing power of music in the medical setting, particularly working with people who are severely ill and at end of life. So I got my child life specialist certification at Mount Sinai Beth Israel while I was there, and then specialized in NICU music therapy, neurologic music therapy. And then when I came back out here, specialized in perinatal music therapy and music therapy assisted childbirth. Did a lot of work in hospice music therapy, both pediatric and adult, and have since then really honed in on inpatient ICU music therapy, palliative music therapy, and really find my interest in providing support through the power of music and its ability to help us express, its ability to influence our physiological state, in environments where relaxation is not present, right? It's not like the ICU and inpatient settings can be full of a lot of inherent stressors, just environmentally speaking. It's so different from someone's home or other environments that feel more comfortable. So I really love the magic that music has in being able to transport people and make them safe and put them in this bubble, both staff who are burnt out and patients and families who have been through, such an intense journey. I'm really fascinated in how music can really just melt a lot of those stressors away in just a matter of moments. It's really profound.
Yeah, and I have so much to talk with you about. And I know before we started recording, you were telling me about the music therapy program at UCLA Mattel Children's Hospital that you were instrumental in being, starting. So tell us a little bit about that. And then I'm curious about the work you were doing in the NICU there.
Yeah. Oh my goodness. Yeah, I was there for about 6 years, and I would say we made a pretty big wave, and we saw almost 10,000 patients. We had 13 music therapy interns through university affiliation that did their 6 month training before becoming board certified music therapists. Um, we had 7 research fellows that did, year-long fellowships and helped us with our research studies. And we had 3 IRB approved published research studies. One of those involved the NICU. It was absolutely amazing. We're hoping to get music therapy back there to peds. I left that position in February to join the integrative medicine team so that music therapy can span to all ages, not just pediatrics. So we're kind of starting from scratch in a way, and being able to build a foundation that can span to all ages and reach more people eventually. So that's where we're at now. But um, the music therapy program, I really, really wanted it to be intentional. And part of that intentionality involves a training program that is going to foster a future generation of music therapists who take care of themselves. So I know we were having a great conversation about burnout, vicarious trauma, secondary trauma that healthcare workers experience. So I really wanted our program to focus on being a support for healthcare workers around us and providing that staff support, providing just building relationships with the whole multidisciplinary team and becoming a pillar of support. So some examples of that would be, training our interns to lead guided meditations at the beginning of every multidisciplinary team rounds for our pediatric palliative team. So we would kick off our, weekly interdisciplinary team meetings that can be really heavy and really sad, talking about the turns that people have taken in their medical journey. And we would really set the tone by providing opportunities for expression, singing, relaxation for doctors, nurses, social workers, everyone on the team. We'd also provide environmental staff support music in various parts of the hospital multiple times a week, and staff support groups, and also just involve them in music therapy sessions when we were at bedside so that they have the opportunity to see glimpses of patients and families that maybe they don't get to in their usual visits. They get to learn the kind of music that patients like and play along and grab a guitar. Doctors and nurses would get to play ukulele with patients during our sessions. And we really wanted that very immersed, involved type of music therapy program, which I know many are in hospital settings. Another component to addressing burnout is I wanted to make sure to address it within my own team of music therapists. So we've come a long way in the training of music therapists, but like any profession that is a caregiving profession, there's still so much more to learn about the impact of holding on to stories, being exposed to trauma over and over again all day. It can really collect itself in the body. It can manifest itself in the psyche, and it can present itself by just creating fatigue in the body that is just the ultimate exhaustion, or even depression, anxiety. It can create PTSD symptoms when exposed to so much trauma. I know a lot of medical professionals deal with disturbing images, not being able to turn off when they get home, feeling hypervigilant, and also in some cases not really enjoying things that they used to enjoy, just feeling completely burnt out on the days that they're not working and unable to do anything. So I thought it was really important to create a curriculum for our interns that focuses on first understanding what is burnout, what is vicarious trauma, secondary trauma, what does it look like, how does it happen, and then what are the warning signs and what are some assessments that we can be doing. So I gathered a lot of like social work and psych assessments that we could be taking for constant self-assessment, and then tried to develop a sort of a protocol that introduced interns and fellows to a variety of self-care and self-discovery techniques, from meditation to, ecotherapy and time outside, to journaling, to using music, practicing what we preach, to write songs, to express, to produce, and to gather all of these feelings and help bring things up from the subconscious, and release them, process them. So yeah, we had monthly retreats with our team that focused on studying new ways of healing. So yoga, Reiki, nutrition, looking at all of these things that come into play that help us feel whole. There was always a lot of comments like, this music therapy crew, they're always so happy. They're always so chipper. They seem so calm. They seem,
Yeah,
it's, there's a reason for that.
I hear you.
Yeah.
So I want to ask, as someone who's an outsider to the music therapy world, I am curious. I know it's more sophisticated than this, but is a form of music therapy just as simple as, hey, I get into my car after a stressful day and I put on the tunes that I like, and that physically just like feels like it relaxes me?
You are using music as therapy yourself in that moment. Absolutely. So the Music Therapy Association, the American Music Therapy Association, defines music therapy as the use of music for change, to promote change within the therapeutic relationship. So technically it's with the support of a trained music therapist, but part of a really good music therapy, when you're involved in music therapy, is using music to cope in the way that you normally would, and just bringing that into your life as much as possible. So absolutely, that like therapeutic, cathartic release that you get when you're in your car at the end of a long day using music, absolutely. Or even, when you're intentionally using music to help yourself calm down, that is a very self-aware, resourceful way to use music in your own life. You're regulating your body. You're regulating your bodily responses, your parasympathetic nervous system with music. And it's a free, cost-effective, and very accessible tool that we all have. So absolutely. Yeah.
Yeah, one other shout out to music is, I'll say, as an outsider, I know that if I want to go to like the gym after a day of work and I'm not feeling it, my body's not feeling it, if I put in my headphones and put on that song I like, sometimes it's just enough to get my blood flowing, and then it gets me to actually work out. Am I onto
Yes.
something there?
You're definitely onto something. So we actually utilize the very same concepts that you're talking about in our music therapy rehabilitation sessions. So in neurologic music therapy, what you're speaking about is actually entrainment. So our physiological state entrains to whatever music we're listening to, which is really important to keep in mind. If you have you may be causing the opposite effect that you actually want. But your heart rate is going to eventually match and entrain the rhythm, the tempo, the beats per minute of what you're listening to, and your whole physiological state, your respiratory rate, your oxygen saturation level changes when you're listening to music. Everything about your body begins to entrain, including your movement. So it stimulates every part of your brain when you put on music, including your brainstem. So we use music in neurologic music therapy to promote gait training. So helping someone to walk again, helping someone who maybe has had some brain damage, traumatic brain injury, or any sort of deterioration. We use music because it is processed throughout the entire brain, not just one part of the brain. We are able to use music to create new neural pathways and to stimulate the whole body. So music and movement is huge. So we're able to help Individuals who maybe have some brain damage in shifting their body weight and gaining balance again, walking again. I mean, imagine in physical therapy when you're learning to walk again. A lot of physical therapists use music, but we love to co-treat with them because we can adapt in the moment to support them and walk down the hall with a guitar with them. And then, you're walking towards the music. But providing that solid beat, your body can't help and your brain can't help but to match the downbeat. Versus if it's just silent, there's less motivation. I think you're also bringing up the motivation piece as well. There's nothing to match. The body doesn't have that desire to entrain if there's silence. But having, even if it's just a beat, not music, but just a consistent beat, it's almost impossible to resist meeting a beat. It's in us, where music is so ingrained in us since 14 weeks gestation in the womb, we're able to process music. We're able to hear it. And then as early as 16 weeks, between 16 and 20, there's been research done that shows that the fetus can identify particular songs and particular voices. So it truly is embedded in us since before we're even born.
That's so cool. So I want to ask more about the American Music Therapy Association. We've talked a little bit about it earlier in this interview. Tell me about some of the research that supports music therapy's benefits. And, I'm assuming some of that is in collaboration with the American Music Therapy Association.
Yeah, there's a lot of research out there on music therapy and different specializations and specialty areas where the research really focuses, and there's meta-analyses on each group of people and need that music can support. There's so much to say about it. I can kind of speak to some of the main areas that have caught on a lot of popularity in the medical setting, if that's okay.
I would love that.
Yeah. So first and foremost, I have a particular interest in the neonatal intensive care unit, particularly because it is just so fascinating how with the monitors, you really see the instant impact of music as it's happening and on lullaby, right? So these are these new, fresh lives, many times underdeveloped. They're born early or they have, some other complication medically going on, and they're as new as they can possibly be to this world. And you get to see music still having this profound impact when they haven't had a whole lifetime of associations of music in their teenage years where, they have emotional connections necessarily to music in the way that an adult or a teen or even child would, but you still see the physiological impact of music very dramatically. So there's actually been research done out of Florida State University by Jane Stanley that shows that music has the ability to help neonates get released from the hospital on average of 8 days sooner than those who do not receive music therapy. She has found that music has the ability to help them entrain and regain their suck, swallow, breathe coordination and improve their non-nutritive sucking capacity. So she even developed a device called the pacifier activated lullaby that we used in the hospital as well. At UCLA, we did a little study kind of piloting it in our NICUs. But basically, we're able to record a lullaby, ideally using mother and father's voice or parents or the caregivers known most to the baby, recording their voice with a personalized lullaby that they've co-written that becomes their special song that's, in their native language, is culturally appropriate to them, is meaningful to them, and delivers messages of love and support for the baby. We're able to record that onto the device, and then it's attached to a pacifier that is used for stimulating and encouraging non-nutritive sucking, which then in turn helps them with their oral feeds, which oftentimes can be one of the final things that needs to happen to help them gain weight and help them leave the hospital. So when they suck on the pacifier, it plays the music as a positive reinforcement. And you can, manipulate the contingency to help them exercise their non-nutritive sucking. But she found that infants who were exposed to this type of music therapy were able to improve their non-nutritive sucking, their coordination, and they were able to gain weight. They were more relaxed. They had pain reduction, and there was, caregiver stress reduction, and they were able to leave the hospital sooner. So that's just one example of the power of music. There's also been a lot of research on neurologic music therapy and its ability to help with neurorehabilitation. So, individuals with aphasia or any type of altered speech from a brain injury demonstrate a much more efficient and productive ability to retrain their speech ability when music is involved. So particularly using melodic intonation therapy. That's what Congresswoman Gabby Giffords attributes to a lot of her recovery, was using melodic intonation therapy, which is essentially using rhythm, like we spoke about before, paired with melody to learn important phrases over and over again with repetition, melody. I mean, similar concept to learning our ABCs. Imagine trying to learn your alphabet as a child without a melody. Or a lot of early childhood songs really help us in our retaining information and our language development. So similar concept. So by using that melodic intonation therapy, new neural pathways are able to be created, little shortcuts, if you will, to access that language that otherwise has some damage and roadblocks in being able to be accessed. So they found that people who receive this type of melodic intonation therapy, this type of music therapy consistently, are able to speak again much sooner and much more clearly, and without as much anxiety. So, which leads me to my next point, that there's been so much research surrounding music for relaxation, music for anxiety and stress management, music to elevate mood, decrease depressive symptoms, and improve overall mental health, which I think is really important to keep in mind in this day and age, with the pandemic and with all the collective stress and grief we're all under. There's also been a lot of research surrounding music to improve communication and improve development for children, infants and children, and also to support individuals who maybe communicate differently in being able to have a way to express themselves. So it really can improve overall social functioning and ability to express.
This has been an incredible interview. We're talking with Jenna Bollard-Marcovitz. There's just so much that we can discuss, and I want to be respectful of your time, but I do want to have a final question here for you, just kind of open-ended. Let's talk any closing thoughts you have on music therapy, and in particular, how it can benefit healthcare workers that are fighting burnout, fighting emotional exhaustion. Let's hear what you have to say on that.
Definitely. I think first and foremost, music can be helpful, as we mentioned before, in shifting your physiological state. So first, embracing that and knowing that that's a superpower. That's a really powerful tool to be able to access so easily. So I encourage first and foremost, just beginning to, if you haven't already, assemble your playlists for different physiological states that you'd like to achieve, keeping in mind average beats per minute. Healthcare workers are usually very in tune with heart rate, their physiological state. So just reminding you to take care of yourself too, and use music as that superpower to be able to shift you to a new state. So as you mentioned, getting in your car at the end of the day can be really powerful. Also, having a cathartic playlist that helps you with your emotional release, having a deep relaxation playlist that you begin assembling, and that can really just be music that's instrumental only, and finding things that jive with you are most important, things that are really your preference. You don't need to be forcing yourself to listen to classical music if you don't like classical music. Beginning to put together those resources for yourself if you haven't already. Also, begin exploring vocalizing. As a vocalist, I really feel strongly about the power of the voice. I definitely encourage people to check out Diane Austin's vocal psychotherapy technique, and finding a music therapist even who can support you in even just 1 or 2 sessions. Singing can be such an amazing way to release emotions that you don't even know are there. No one has to hear you even to start warming up to this idea. If you're singing in your car, awesome. Singing in the shower, humming, when no one's around, the vibrations are healing for your body. The breath that is required to hum and to sing is going to engage your vagus nerve and is going to immediately sedate you and make you calm. So use this free, accessible healing tool that you have available to you. And also begin turning to music as kind of a friend who can relate to you. Listen to the lyrics and the moods of music, and grant yourself that opportunity to just kind of let music hold you in your feelings and your emotions, and know that that is a strength. Back in the day, people used to listen to vinyls and, lay on the floor and really listen to an album all the way through. And I feel like that's a little bit lost at times in this, a Spotify, iTunes, one song at a time. You just listen to a 99-cent single kind of world that we're in now. But I encourage you to also just intentionally listen. Music and mindfulness connect in so many ways. And that in and of itself, just giving yourself a 5-minute song of just undivided attention is such a gift for yourself. To just do that a couple times a week even, you'd be amazed at what that does to your cortisol levels.
She is Jenna Bollard-Marcovitz. She's a board certified music therapist, certified child life specialist, certified Reiki master, and a student of traditional Chinese medicine. I am definitely going to include her website as well into today's podcast description. Jenna Bollard-Marcovitz, thank you so much for your time today and for all that amazing insight.
Thank you. And also, I want to encourage everyone, if you, are a healthcare worker, if you're struggling, if you're feeling really burnt out, feel free to reach out to me. I can do a distance Reiki session for you, or a distance, guided meditation, or just open up the floor to be able to process a little bit. We're all in this together, so don't be shy. Feel free to reach out.
Thank you, Jenna.
Yeah, thank you.